Good and welcome. Thank you so much for joining us today as we walk through Davis Advantage Med-Surg. It's been a little over a year since we launched this all-new Med-Surg solution, and we are so ecstatic at the reception that we received. Currently, it's being used in over 160 programs throughout the country with over 10,000 students using it. We want to introduce Davis Advantage Med-Surg to you and walk you through some of the features and functionalities so you can see what it can do for your students and how it can help you overcome some of your teaching challenges. My name is Kristen Testa, and I'm on the Med-Surg team here at FA Davis, and today I'm joined by my colleague, Lauren McNeil. A lot of important information that we want to share with you today. To ensure that everyone on the call has the best audio quality, we have muted your lines. However, we definitely want to hear from you and keep the session interactive. So anytime throughout the session, please feel free to share any questions, comments, or feedback with us, and you can do that submitting them in the Q&A box, which you can find at the bottom right-hand corner of your screen. So as submitting your questions, your feedback, we're chatting with you, but we'll also open it up at the end and try to answer as many questions as we can as time allows at the end of the presentation. But the Q&A portion at the end is not the only way for you to get your questions answered or to request additional information. At the close of the webinar, we will have a brief survey that's going to pop up. So take a minute to fill that out. The survey is a really great way for you to, again, share your feedback with us, submit a question, or interested in receiving a copy of our Med-Surg book or access to Davis Advantage and Edge, let us know in the survey, and we'd be happy to follow up with you to get you started on your requests. So before we get started and jump in with our walkthrough, we'd love to hear from you and have you share with us some of your feedback on some of the biggest teaching challenges that you're facing in your classroom. So take a moment and put them in the Q&A box, which is at the bottom right-hand corner of your screen, and let us know some of the biggest challenges or struggles that you're facing as you're teaching Med-Surg. So I'll give one a moment to type those in. Coming in, I'll read them off and share them with everyone on the call. So I see some coming in that's saying students not reading, having trouble making the connections, quite a few coming in saying content overload and the volume of content, and needing to know what the focus is for students and knowing that need to know information. Let's see. Keeping students interested, keeping their attention, not just memorizing, but actually having trouble learning. Application and applying the concept. So these are great challenges that shared with us. Thank you so much for your feedback. Really, we'd like to open our webinars with this exercise to ask what challenges are, because we think it helps to put things into perspective and also set the tone for what we're going to talk about today in the webinar. And to put those challenges into perspective and see that no matter where you're located or how big or small your program might be, that these are all common challenges that everyone around the country is facing. So really, you're not alone. And really, it was these same very challenges that as we were talking with instructors, as we developed Davis Advantage for Med-Surg, that we kept top of mind. And really, with Med being such an important course, and there's that sheer amount of content, and the importance of that content is overwhelming, both to students and both to faculty as well. And it was really our goal when we designed Davis Advantage for Med-Surg to create a program that could help overcome these challenges and really help you meet your unique classroom needs and also keeping the needs of today's students in mind, because we know that their needs are changing and their needs are evolving. So you need to be able to keep up with those changing needs to be successful in the course. So as we designed Davis Advantage Med-Surg, we thought about the needs that we heard from faculty as we spoke with you during that development phase. We also thought about the needs of today's student, what the need and how that's evolving, and how they're really into technology and consume information in small dynamic chunks. We also listened to your struggles, your feedback, and put all those together to develop this comprehensive solution to make it easier for you to teach Med-Surg and help you overcome those challenges. We get your students engaged so that they're coming to class prepared, participate, and really own their own learning so they can make those connections to be successful students and go on to be successful nurses. By approaching learning a whole new way, by using a learning, applying, and assessing approach that stresses active learning. So we've taken into consideration the depth and breadth of content in the Med-Surg course, and we present it in a way that appeals to today's learner to really get them more deeply connected to that content while making learning personal for them, because we know that their needs vary. Their learning be tailored to their specific strengths and weaknesses. And we give students the tools to be able to track their progress, so they know what they're struggling with, they know what their strengths are, and know how to remediate to make those weaknesses stronger. So Davis Advantage Med-Surg is comprised of 3 components. It's our brand new Med-Surg textbook and online resources for personal learning and online quizzing. So we'll walk through each component today, but we're going through, just keep in the back of your mind that these pieces, while they're separate components, they're very much interrelated, and they work together to form a solution that makes up a dynamic experience for your students. We're going to jump in right now, and we're going to start off with the learning component of the solution, and that is our Med-Surg textbook, Medical Surgical Nursing, Making Connections to Practice. So when our authors were designing this textbook, they wrote it because they felt so strongly that there was nothing available today that was truly learner-focused. So they really worked hard to imagine the content from the student's perspective and created this textbook so that it clearly and consistently answered the question, what do I need to do as a nurse? The book was built from the ground up and caters to today's learners and uses a fresh, student-focused approach that really promotes critical thinking and clinical decision-making. Also use a concise and consistent organization that makes it very easy for students to follow and helps them to make those connections to practice and connect the concepts to actual patient care. Back to the challenges that we talked about at the beginning of the webinar, where some of you shared that content overload or the volume of content. This textbook helps to address that challenge because we're promoting efficient learning by focusing on that need-to-know information and emphasizing the patient-centered role of the nurse. I'm going to take a look at some of the hallmark features in the book, but if you haven't got a copy of the textbook, let us know either at the end of the webinar, through the survey, or in our chat box, and we'd be happy to get you set up so you can receive a copy so you can take a look at these features that we're walking through in more detail. The feature that we're going to talk about is our connection checks. And these appear in every chapter. There's multiple connection checks in each chapter. Think of these as speed bumps. They're really there to help pause the student, help them to evaluate the understanding of what they just read as they're going through each section of the chapter. And each connection check that they come across is going to align back to one of the learning outcomes that's presented at the beginning of the chapter. We have unfolding case studies that appear in each chapter that help students to make those connections to practice and connect concepts in patient care to practice. Each case study is going to start off as called Finding Connections. And here, students are going to be introduced to a patient that's related to the chapter content. I'm going to follow that case study as it unfolds throughout the chapter, and it's going to help them to apply the content to see really how it applies to practice. At the end of the chapter, the case study is going to wrap up with something called Making the Connections. And here they get a wrap up of the case, and they're presented with critical thinking questions that they must answer. The feature is my favorite feature in the book, and one that we are really, really excited about. It's really become our standout feature that we're hearing positive feedback from instructors that are already using it in their programs. Because the way that we cover our nursing management section is not something that's done in any other Med-Surg book out there, so it's completely unique to our book. So in every chapter, we have nursing management sections. They are very consistent and clearly labeled for students to be able to easily find. In the nursing management sections, it's going to show students how it focuses on the nurse's role and how to provide the best care for their patients. So use the nursing process and also prioritization of care, and help to reinforce what the nurse's responsibilities are as part of an interprofessional care team. So students are not going to have to go through and try and find what their role is or what their job is going to be as a nurse. And every single chapter, it's clearly identified and defined, so it's easy for students to find. In the nursing management section, it's really where it's designed to help students put that big picture together and help frame their thinking. So help them to think about what's wrong with the patient that they're taking care of, or how do they provide care for that patient. Also focuses on the correlations between the clinical manifestations, the diagnoses, and the interventions. Things that we often hear, and I'm sure you hear as well, that new students as well as new nurses struggle with is prioritization of care. So what should they see first? How should they organize the care of one patient? How does care change if they have multiple patients? So nursing management sections, we have nursing interventions, and they include prioritization of care, and they're organized by safety, ABCs, and also hierarchy. So simple for students to understand, and really something that they can remember once they move past the book and are in that clinical environment. To be referenced, in the nursing management sections, they're all consistently broken out into 3 categories: assessments, actions, and teachings. And in those categories include rationales for a point that's going to correlate directly back to the physiologic or the pathophysiologic basis of that chapter's disease or disorder. So let's look at the assessments, actions, and teachings in the nursing intervention section. So the assessments, those are going to be things that the students are going to have to assess and why they need to assess them. For actions, those are these things like what actions are they going to have to take, or things that they're going to have to do with their patient. And the teaching are the types of things that they need to teach their patient or teach the patient's family on how to best manage their care. And the last feature that we're going to end on today is safety. So really, safety is a central theme of the book, and something that's continuously focused throughout. We also do have these great safety alerts that stress the important aspects of safe care to help students avoid potential hazardous or high-risk issues. So some of the features that we're going to cover today, but again, if you haven't got a complimentary copy of our book, let us know. We'd be happy to get a copy out to you so you can go look at these features or just do a more in-depth review yourself on what the entire book entails. So let's talk a little bit about some of the hallmark features in the book. Before we move away from the book and move on to the next component in the solution, I just quickly wanted to call your attention to the instructor resources that we have available for you. So we have those traditional ancillaries to help support learning through the test bank and also PowerPoint presentations. And another resource that we've gotten a lot of positive feedback about is our implementation guide. That's going to provide you with an overview of how to use Davis Advantage MedSurg in your course, and it's actually going to break it down as a sample syllabus for you with a week-by-week overview that shows you how to integrate the book, the Advantage, and the quiz assignments in Edge each week to really make that seamless transition and make it easier on you to use the solution in your course. So the student resources that we're going to get into right now on our brand new platform, Davis Advantage. And we also have some really great teaching resources for you as well. And this is what's going to comprise our application component of the solution. So I'm going to turn it over to Lauren, and she's going to introduce Davis Advantage and know how it works hand in hand with the textbook to help students make the connections.
Great, thank you, Finn, and hello everyone. Thanks for joining us today. I saw some of your challenges as they were coming through, the volume of content, students aren't reading, content overload. So those would really resonate, especially with this applying portion for Davis Advantage. Davis Advantage was really built to address those top challenges that you're going through as instructors. So with the volume of content that students are seeing in MedSurg, it's really easy for them, as I'm sure you know, to be overwhelmed and to try to memorize all of the content, and that's just not effective learning. This brings us to Davis Advantage, the applying portion of our solution, and it's really here to provide an interactive, personalized learning experience that's going to be tailored to students' specific individual needs. Davis Advantage works hand in hand with the textbook to really help students to navigate those key areas in MedSurg. It'll help them expand and apply their knowledge in a more meaningful way. For instructors, we provide tools to identify those at-risk students and at-risk topics to offer personalized teaching plans that are going to transform the classroom into active learning environments that maximize student success. So let's go ahead and work through Advantage. So I'm going to start off by talking about how easy class setup is for you. We're going to go through the student experience, and then we'll on back to the instructor side to show you all of the tools and analytics that you can use to amplify your classroom. So I'm going to pass things back to Kristen to kick us off with class setup on the instructor side.
Thanks, Lauren. So let's talk about class setup. When we created Davis Advantage, we wanted to make sure that the class setup would be as easy as possible for you. Really allow you to create the class that you need. So class setup is definitely a breeze for you to do. In under 5 minutes, in 5 steps, you have your class set up. So we know that every program is a little bit different, and the way the course is also taught can be different. So to start off with you, we're going to give you the option to use the organizational framework of how you want the content presented. So you could choose a traditional approach, and that would be if you teach by buddy systems. Or you can also choose a concept approach, and that's if you teach in a concept-based program. So all great content is going to be included for you in Advantage, no matter which organizational framework you choose. The biggest difference here is how that content is organized. So traditional is going to be organized a little bit differently than the concept. But that's it. And then your students are only going to be able to see the view that you selected. So for our walkthrough today, we're going to stick with the traditional. And one Davis Advantage is it's ease of use and how it can be completely flexible and customizable to meet your needs. So here on the screen is where we're going to be able to customize that content and create it your class so it reflects the way that you teach. There really is no one-size-fits-all approach here. Everything is completely customizable for you. So as we included all the key areas that we found through speaking with faculty that most Surg courses cover. So there are 60 topics that are in Advantage, and default, all of them are going to be selected for you when you're setting up your class. However, you have that full control with really just a click of a button to customize based on the content that you plan on covering. So as you can see, as Lauren's doing on the screen, on the left-hand side under that status column is where that you get to control the content that is shown to your students. So seeing the on or the off button, that's going to either have it show up in your student's dashboard as an assignment, or it's going to hide, and maybe it's something that you're not covering and that you don't want to go over with your students. So click off, it's not going to be available to your students. They're only going to see the topics that you chose to keep as on. So I'm going through the topics. If you want to take a peek and see what each topic entails, you can do that by clicking on one of the 3 links that Lauren's hovering over right now. So clicking over the preview link, here you'd be able to preview that topic and see all of that great interactive content that is included for your students, which we are going to show you momentarily. You're able to preview the assessment questions. So there's pre-assessment that students are going to start off with at the beginning of a topic, and they're tested again as a post-assessment at the end of the topic. So you're able to preview those questions that appear to see if that's something that you want to include. So you've gone through, you've turned off topics that you don't want to cover and you don't want your students to work through and left the ones on that you do, you hit save and continue and move to the next step. So here is where you're going to reorder the content. So once you've selected that content, we know that not everyone's going to cover it in the same exact order. So here you can reorder by simply dragging and dropping to put the topics in the exact order of the way that you plan on teaching them. Once you move them around and they are to your liking, then you just click save and continue and you go to the next step. So here we'll set start and due dates. So the start date is when the topic is going to appear as an assignment for your students, and due date is when it needs to be completed by. So you have that flexibility to select dates based on the needs of your class, based on what you feel would be best for your students. So we've seen instructors give access to all of the topics with the due dates being like the midterm or at the end of the course. Or if you are an instructor that likes to pace your students, you can give essentially each topic its own start and due date so students can work on them in the appropriate order to help manage their priorities and really what they should be focusing on at a specific time. It's up to you. So we selected those start and end due dates. The last screen is just your summary overview screen, and really it's just a nice screen that's going to give you a snapshot of everything that you just did. So print it out and give it to your students as a syllabus, or you can just use it to check your work to make sure everything is set up the way you like. And really that's it. It's simple and very easy to get started. So now that you've set up that class, your students are ready to get started. So Edge was designed to be used as a complement to work hand-in-hand with our MedSurg textbook. Essentially, students will complete their readings and their assignments in Advantage prior to class, and then you are able to monitor their performance so you know that before they step into your door, they've completed the work and they're ready to participate, and they at least have that foundational knowledge so you can spend your class time focusing on more important higher level learning. So we'll talk a little bit more about that later, but I'll pass it back to Lauren and she can talk more about the student experience, what Advantage offers to them with that personalized learning.
So let's take a look at the student experience. As soon as a student logs in, they're going to see this assignment dashboard here and all of their current assignments that they've assigned by the instructor. Assignments are listed by their due date, so that allows students to go right in and see what's due immediately and take them in the appropriate order. And each assignment is mapped to a chapter in the textbook. Prior to class, students can either read from their printed textbook or they can read from their integrated ebook right in Advantage. So by clicking the ebook button here, they're going to be taken right to their specific chapter in the Vital Source ebook. The ebook includes search, highlighting, note-taking, and bookmarking capabilities. And what's really nice is that it can also be downloaded onto tablets and mobile devices to make that studying on the go really easy. This class here has 5 active assignments. Let's dive into the acute respiratory distress syndrome topic, and all of our navigation is intuitive, so what we'll do is just go ahead and click Start. So each assignment starts off with a pre-assessment, which is really the key to the student's personalized learning experience. This pre-assessment is going to gauge their comprehension and their retention of the content that they just read, and those results are what will drive their personalized learning plan. So the pre-assessment is 5 questions, and students can only take the pre-assessment once. So let's take a look at a couple of these sample questions. We can have the questions in standard formats like single answer, multiple choice, or we can have those higher level select all that apply questions that we know give students a bit of trouble. So now that the student has gone through and taken the pre-assessment, they're given immediate and really visual feedback using a thumbs up or a thumbs down system. So a green thumbs up indicates competency, and a red thumbs down indicates the student needs a little bit more work. So if a student receives a green thumbs up and they pass, they're not required to work through the topic, but they can if they'd like more review. So in this example here, the student didn't pass, so they're required to work through the topic. So now that we've gotten a red thumbs down, let's go ahead and see what kind of learning experience and remediation Davis Advantage provides. So Advantage provides a constant and consistent path to learning. For each topic, there's a pre-test, a video, a learning activity, and a post-test, which is designed to engage multiple learning styles and help build a context for understanding. Med-Surg concepts are often really difficult to understand, and reading from a textbook might not spark a connection with every student. Students are often coming to class confused or without that basic information, which means that you're spending valuable class time covering the basics from the textbook. The video that's playing now are interactive, and they provide content in a different way for students to digest, to really spark that initial connection and lay the foundation for students. These videos are brand new and deliver key Med-Surg topics in a way that really connects with students, and it shows them the content in a different way. They're also closed captioned and scripted so that students can read along or print out the transcript and use that as another way to review and remediate. The videos go ahead and they use things like analogies and metaphors to tie the concepts to information that students already know. So it's making it more relatable, more memorable, and giving them visual representations so that the content becomes more sticky and memorable. We've been calling them animated mini lectures because they really work hand in hand with the textbook content, and we've had really positive feedback from instructors who are currently using the videos in their programs. So we've taken a look at the video. After we watch the video, students are going to go ahead and complete the activity. So following this video, students are going to work through any type of activity. This one on the screen here is called This or That, which requires students to think quickly and select the priority nursing action when caring for a patient with ARDS. But other activities could include case studies, bucketing exercises, drag and drop, keeping things really interactive for the student to deliver that content in a different way. So let's go ahead and check the answer. So what happens here? So each learning activity provides immediate feedback to show whether the student has answered correctly or incorrectly. And students, as Kristen mentioned in the beginning, they're unsure of the content that they don't know. We include these detailed rationales to help them self-remediate and build a knowledge base so that they learn and they understand why a response is right or wrong. In the example here, the student did not answer this question correctly, and the rationale is provided as to why the answer is incorrect. Number 2 here, the student did answer the question correctly, but we again include a detailed rationale. So the more times that we can provide remediation and in a variety of different formats, the more likely that content is going to stick with students. We've gone through, we've looked at the video and the learning activity. This is where the post-assessment comes into play. So the post-assessment is specific to that topic, and we'll ask the students 5 questions to make sure they understood what they watched and worked through, ultimately gauging their comprehension. After completing the post-assessment, again, the student's going to see instant results and how many of them they answered correctly. So we see the student answered 5 out of 5, and those results are immediately going to feed back into their personalized learning plan. Personalized Learning Plan, or PLP, is going to show the students' work and progress through the assignments and track everything that they're doing. Individualized based on students' needs, and each student is going to look a little bit different. So students are, as you can see on the screen here, able to easily see their areas of strengths and weaknesses. So remember that a green thumbs up indicates competency, and a red thumbs down indicates they need a little bit more work. Getting back to this ARDS example here we just worked through. We see that the student did not pass the pre-assessment, so it tracks the completion of the video, the activity, and the post-assessment, which we can see was passed with the green thumbs up. Take a look at some of the assignments as examples. So the student in the next example did not pass the pre-assessment for pulmonary embolism. They again had to work through the video and learning activity, and when it came to the post-assessment, it looks like they were still struggling a little bit and had to take the assessment twice before actually passing. But look at asthma here. So the student did test out of the pre-assessment, so it's a good indicator that they understood the reading and the content. While it required, the student did go through and work on the video and the activity. It's always going to provide students with extra practice. So once assignments are completed, students can always go back to review at any time if they would like additional practice or to help prepare them for an upcoming exam. So in addition to these resources in this remediation program, you'll have access to different chapter resources that align with the textbook content for even more practice and self-study. So for example here, in Chapter 25, we see a variety of different activities. I'm going to go ahead and show you the prioritization exercise. And this is going to provide at least 2 patient scenarios, and we'll ask the student to prioritize the care for patients, which we hear is something that students often struggle with, and Krista mentioned at the beginning. Include the answers and comprehensive rationales to help the students understand the organization of the patient care and who they should go and visit first. There's also different activities like concept maps, which provide a visual description of case studies and connections between normal A&P, pathophysiology, clinical manifestations, treatments, and nursing priorities, as well as connection checks, chapter reviews, finding connections assessment questions, just really chock full of activities for students to make sure that they're understanding the content. So the path for student learning is always clear and consistent. Each is set up the same way, so students will know what to expect, and they can track all of their progress in the PLP. Now that we've taken a look at the student side to see what their experience is like, let's go ahead and jump back to the instructor side and talk about how you can monitor class performance and use the analytics to help drive your teaching in the classroom.
So jumping over to the instructor side, all of the classes that you set up can be easily accessed from your class's dashboard. So clicking on that view button, you're able to open up any of the classes that you're interested in. So we'll take a look at that right now. And in your class overview, here you're going to see a lot of that great data that's collected. So as your students are working through those assignments, all of the class data, all of their thumbs up, thumb down, feedback, all of those analytics are going to be populated into your class overview screen. So for every topic, you will have an at-a-glance view of your overall class participation, how many of your students have completed the topic, how is it taking them on average to complete that assignment, and as well as aggregate results of how they performed on a pre- and post-assessment result. So you have that nice high-level overview to be able to look quickly at each topic, but you can also drill down to see individual student performance. Here is where, by clicking on that View Details button, is where you'd be able to see how each of your students are performing. You can see who's struggling, who's falling behind. And another great piece of information is that time spent. So if you that's coming to you saying that they're not understanding, really having trouble grasping the concepts, take a look at their time spent. So it's showing something that's like a short amount of time that it's taking them to complete the assignments, like Frank Davison, an example of taking 4 minutes. That's an indication that the student is just clicking through and going through the motions and just get it done, really not putting any effort, just wants to get that assignment done. However, if you have a student that's really putting in the work, a considerable amount of time in the assignment, yet is still having trouble and not grasping that concept, it really might be a weak area for them. So you have the option that if a student does come to you and says that they're struggling, that you can pull up their individual results from their pre and post assessments, and you can walk through it with them. So you're able to see under that view details button how each student performed on their pre and post assessments. So it's broken into 2 categories, pre-assessment and post-assessment. In green are the ones that your students answered correctly. Answers that are in red are ones that they answered wrong, and the green highlights what the correct answer is. So you always have that answer key of each of the assessments, but it's that you can pull it up if you have, students coming into you during office hours or after class. They can pull up and you can walk through that with them to help them really understand how they're getting something wrong and help to improve the weak areas. To look at the entire class overview, again, how your students are performing by aggregate as a class overview. So we had a lot of conversations as we were working through designing Davis Advantage, through classes that we're attending, that a lot of instructors have said to us that they'll be in class and they'll ask the students, where are you having questions, or what are you struggling with? And nobody raises their hands. It's completely quiet. Because some students don't know what they need help in, or they don't know what they don't know. So here, Davis Advantage is really going to take that guesswork out of it for you, and it's going to analyze your students' performance and highlight the exact topic areas that your students are struggling with. So you're going to know what their strengths are, what they're struggling with before they even walk into your class. And have class data is going to really allow you to intervene right away, and it can help focus your teaching and allow you to dedicate more time and attention to those true weak areas. So just a couple of these assignments as an example. We'll start off with pulmonary embolism. As a class, your students, they did not do well on the pre-assessment. And that's shown again by that thumbs down. So they're struggling with that. But after working through Advantage, so they completed the video, they worked that interactive learning activity. Now to their post-assessment, as a class, they passed that post-assessment. So it could have been an area that was a weak area for them, but going through and working through Advantage and having that content presented in a different way, students, something clicked. Students are understanding, and the topic is looking pretty good for your class comprehension. Is an area that your students did really well in. So they tested out of the pre-assessment. So maybe it was something that they understood from a previous course, or they understood their reading from the textbook, and showing you that this is a topic that, while you're not going to necessarily skip over, it's something that you don't need to spend a lot of time on because your students seem to be grasping that concept. Going back to our example of ARDS that we've been working through as our case study today, this is, again, your students are not doing well and they did not pass that pre-assessment, and even after working through the topic, doing the guided mini-lecture video, working through the interactive activity, they're having trouble with that post-assessment. They can't seem to get a grasp on that concept. So it's highlighting this topic as a problem area where your class needs more attention. So it's recommended that it be added to your teaching plan and something that's covered in class for further remediation. And review a remediation tool called personalized teaching plans. So let's take a look at what those personalized teaching plans are. For all of the 60 topics that are in Advantage, there is a personalized teaching plan for each one. And every personalized teaching plan is going to include 3 in-class activities that allow you to gear learning to your students' weaknesses or allow you to provide that higher level learning aside from that foundational knowledge. So really, you can spend your class time either improving areas or just improving understanding. Personalized teaching plans really are different than those traditional lectures or PowerPoints. They're designed to really get your students thinking, to get them discussing with each other and with you, and sharing their feedback to really strengthen that understanding. And having these personalized teaching plans is going to allow you to flip the classroom and make your classroom more active and have your students be participating. So let's look at what a personalized teaching plan actually entails. So activities are all designed to engage your students, get them more deeply connected with that content, and vary and type to, again, appeal to those different learning styles, but also to keep it fun. So there's things like small group work or case studies. There's also some fun visual and drawing exercises to help present the content a different way. Personalized teaching plans are turnkey, which means they're ready for you to implement. We're not going to give you just some topics and have you come up with the activities. They include everything for you. They include the goals, the directions, the answers for the activities. If there are handouts that are required for the activity, we also provide the handout. So really everything that you need to do that activity is going to be provided to you. Because really we know that you're busy and we know that your class time is very valuable, so that when you have your students with you, we want to make sure that the learning is going to be focused, it's going to be fun, and it's going to be effective. So a personalized teaching plan, again, is going to include 3 activities, and here is where you can choose want to use them. So you can use one activity in class. You can use all 3 of them if you feel like your students really need that extra practice. Really, it depends on the needs of your students, the needs of your course. You have an option to pick and choose, and how much time you really want to devote to each activity. So your students, they've before class, they've completed their reading, they've done their assignments in Advantage, you're able to track their performance. Now let's move on to in our solution, and that is our assessing piece, that is a data edge. So MedSurg being such an important and significant portion on the NCLEX, it was a priority for us to ensure that students in the MedSurg course are understanding these important concepts. So with this edge, as I mentioned, it's the final piece of our solution. It provides quizzing that's going to allow students to help them, give them a practice to master that course content and better prepare them for their exams. Also, it's going to get them used to those NCLEX-style questions, so when they do take the NCLEX, they are familiar and comfortable with these various question types. So we'll talk about each of these in a little bit more detail, but just a couple things that set Davis Edge apart from some other adaptive quizzing programs out there. So the first being the type of questions that we provide. So all our questions really are high-quality questions. Over half of them are written at the application and analysis level because we really want to challenge students and help them develop that critical thinking. We include detailed rationales. So as students done with their quiz, they're going to get immediate feedback and get the rationales for not only the answer that they selected, but they're going to get it for all the answer options. So they're going to be able to really understand why something is right or why something is wrong. And then for instructors, we are going to give you tools with Edge that's going to allow you to take the pulse of your students' performance. So you have real-time information that's kind of monitor your students' comprehension and their retention of the topic. So how well are they understanding the content that they're learning? You're also going to be able to take a look at their participation, their engagement, keeping up with the depth and the breadth of content within the course. And also going to be able to look at their test-taking skills. So adapting to those NCLEX style questions and improving as they go work through assignments. So we're not going to go into a full walkthrough of Davis Edge today. We're going to show some of the key functionalities and features on the instructor and the student side. But if you're interested in seeing a full walkthrough of Davis Edge and really how it can work to fit your needs and be and work as a part of Davis Advantage, let us know again, either in the chat box or at the survey at the end. We'd be happy to set you up with a more in-depth walkthrough of the solution. So the first thing we're going to cover is the types of quizzes that you can create in Edge. So if you think of the readings from the textbook, assignments in Advantage as something completed before class. So think of that as the before class learning. You can use Davis Edge as an after class resource to get your students' comprehension after they leave your classroom. In Edge, there are over 3,000 questions that were written specifically for the Med-Surg textbook and cover all of the topics in the book. So really it makes it easy for you to be able to create assignments that target those readings and what your students are learning in class. And options of the types of quizzes that you can create based on your need or based on the amount of time that you might have. So we'll talk about each of the three. The first is being able to create a quick assignment. So with the quick assignments, you would select the topics or concepts that you'd like the quiz to cover, and Davis Edge is going to actually select the content for you within those topics. The assignment is where you have a little bit more control to customize. So again, you select the topics or concepts that you want the quiz to be about. You also choose the types of questions that you wanted to be in the quiz. So you want just standard multiple choice or maybe some more of those difficult alternate format questions to help get your students used to those difficult types like select all that apply or fill in a blank, ordered response. You have options. You can also choose all of them, and Davis Edge will randomize and pick questions of each type. With the custom assignment is where you actually are able to select the questions that you want to appear in the quiz. So you have that level of control on the content. And the final one is the preset assignments. And here we've done the work for you. So what we did is for every topic in Edge, we created a 20-question quiz that's ready to go. So you just can quickly assign it to your students to give them additional practice. If you want to take a look at them, you do have the option to be able to preview the questions. You also can remove and replace the questions if you would like other content to appear in the quizzes. So assigning those quizzes to your students, you have a great dashboard that's going to allow you to monitor their performance, and that's through your Success Center. I think of that as like your hub or your like control center. The Success Center is where you have access to your grade book and a great analytics that is going to allow you to take that pulse. So you're going to have to wait till 3-4 weeks into the course or after that first exam to see how your students are performing. You really assign quizzes right from the beginning, track their progress, and intervene where you need to right away. We also revamped the entire dashboard really to make it more user-friendly. We did that this summer, and one of the enhancements was at a click of a button, you can now identify your at-risk students, so you can quickly pull those up and decide, how you want to further remediate with those students. You also have your grade book. That is where all that data is going to live as far as how they're performing and what their grades are for each of your quizzing assignments. So we're to Lauren, and she's going to wrap up Davis Edge talking about some of the student features.
Thanks, Kristen. So like we saw on the instructor side, students also have their own Success Center that's going to help track their progress. So this is show them. Are they understanding the content? Do they understand what they read in class? And what are their strong and weak areas? And it's really nice and visual for students to see at a quick, at-a-glance look. Success Center is also aware they're going to take quizzes that have been assigned by you, the instructor. So if you see this red box here over the My Assignment tab, that lets them know that you've assigned something for them. Students can also go in and self-remediate and practice on their own. They can create practice quizzes based on their time and their need. They use from a phone or a tablet, so it makes studying on the go really easy. The student only has a few minutes between classes, and they know they have an area they want to review before coming to class. They can create a quick 5-question quiz for themselves, or a more in-depth 20-question quiz if they have more time. And the nice thing is that everything a student does independently feeds back into the grade book for you, the instructor. So you'll always see students who are working outside of the class content that's assigned. There's also a nice Tips for Success link, which is going to be tips that help students to improve test-taking skills. Let's go ahead and take a look at one of the questions from Davis Edge to show you what that looks like. So we've often heard feedback, and Kristen touched on this a bit as well, that other quizzing products primarily include knowledge-based questions that don't really provoke critical thinking. And we let students need to have those challenging questions. So what we've done with Davis Edge is to make sure that questions are across all cognitive levels and focus more on the application and analysis type questions to help them learn at the higher cognitive level. Question types feature single multiple choice as well as alternate format questions such as prioritization, fill in the blank, select all that apply, as seen in this example here. And we know that these are the types of questions that often draw the most anxiety from students because they're most often the most difficult questions to grasp. So we provide a lot of opportunities for students to practice with these alternate format questions. And we have 20% of the total questions in Edge being alternate format to make sure that they're getting practice. So students have gone through and taken questions, and this is what their feedback screen is going to look like. So just like with Advantage, we want to make sure that every moment is a learning moment to remediate. Our remediation will feed into this feedback report here. And each question includes detailed rationales for all answer options to provide on-the-spot remediation. And we encourage students to go through and read all rationales, even if they did select the right answer. But we want them to be able to understand why they answered a question correctly or incorrectly and have it not just be a lucky guess. So every learning is going to be a learning moment. Students are going to have that comprehensive explanation to help have a better chance of having that information stick going forward. Many questions, like here at the bottom, include test-taking tips. So they're included as a link in the top of the program, but also embedded throughout questions as well. And these are really here to help students understand how to interpret and take different types of questions so they become comfortable and have those tips to help them succeed. So we've taken a look at Davis Edge, and that really wraps up the Davis Edge portion of our solution. So I'm going to pass things over to Kristen to wrap things up and talk about our electronic charting solution as well.
Thanks. So just quickly before we wrap up, I wanted to mention the EHR program that we have available and how it can work with our textbook. We're really excited that we have now partnered with EHR Tutor and are now able to provide an electronic charting solution that's really affordable and also customizable. And it can be used in your classroom, in your sim lab, or also during clinical rotations. Back to remember the unfolding case study that we talked about at the beginning when we were going over the features in the book. Each chapter, students are going to be introduced to a patient scenario with those case studies, and you can use those case studies to hold them up in class to help illustrate the important points of the chapter. And we've done that by creating patient charts for those case studies. So you can pull a patient chart up in class, and you can use it really to bring those case studies to life. So going back to the ARDS example that we've used throughout the walkthrough, you can use these patient charts in class to really reinforce those key points and help to illustrate those concepts. We're going to visit a patient virtually in the hospital. So, as well, for using cards, that we have a patient that has been diagnosed with acute respiratory failure. And you can pull up this chart as you're talking about ARDS, and you can walk through it with your students and everything from his assessment, through his diagnosis, through his medication. You can ask them to talk about what they're seeing in the chart, or ask them how they prioritize care and what should they do first for the patient. So, action charts available in class is an effective way of giving your students exposure to the clinical experience on the fly, and it allows them to meet a specific patient to help make the type connection and really help them to think critically like a nurse. So we don't have time to do an actual walkthrough of EHR Tutor today, but if you're interested in seeing more of this program, what the instructor and student feature like, and how it can work with this MedSurg solution, let us know, and we'd be happy to set you up with a more in-depth walkthrough so you can really see how everything works together. So that's going to wrap up the presentation today. Thank you so much for taking the time to join us. I don't see any questions that have come through in the ones since we've been chatting with you. I think we've answered everything. I don't see any additional new ones that have come through. If you have any questions after the webinar, or maybe you think of something next week, let us know. We're more than happy to help answer any questions you might have. Again, momentarily, the survey is going to pop up on the screen, so you can use that to ask any questions you might have, share your feedback with us, or if you'd like to get access to Davis Advantage to test drive it yourself, or get a copy of the book to review it in more detail, we'd be happy to do that. You can email us at any time at medsurg@fadavis.com, and we'd be happy to personal support that you might need. So thank you so much for taking the time to join us today. We really hope that you'll consider adopting Davis Advantage MedSurg for your course. Thanks again.